Hi, I'm Kaitlin Graye, and I'm a nurse practitioner at Woodlands Weight Management and Wellness Center in Pensacola, Florida. I grew up here locally in Pensacola, where my family's lived for generations. I attended the University of West Florida for my undergraduate studies and went on to the University of South Alabama to complete my master's in science and nursing, specializing as a family nurse practitioner. I've worked in healthcare for almost 10 years in a variety of settings, including emergency medicine, long-term care, ortho-neuro-trauma, peri-op, and home health care. I think that the wide variety of settings that I've worked in really helped me develop a deeper understanding for the dynamics of how our healthcare system works, which helps me help my patients better navigate the healthcare system. During my time outside of work, I enjoy spending time with my family, bike riding, weightlifting, traveling, and helping my husband run our family business. Traveling has become a big passion of mine because venturing outside of your comfort zone and challenges you to embrace other cultures. And stepping outside of your normal day-to-day routine often gives you a chance to really appreciate the little things in life that we often take for granted. My favorite part about living in the Florida Panhandle is the sense of community we have here. I love the small town feel Pensacola has. It's very rare to go to a community event and not encounter at least a few friendly, familiar faces. Living in a small town gives you a unique opportunity to be part of something larger than yourself. It's a tremendous privilege to be a healthcare provider here because you get to build these long-lasting relationships and care for people throughout their lifespan. I think it's extremely important to recognize this privilege also comes with a great responsibility to care for each and every patient as if they were your own family. Creating these strong patient-provider relationships leads to improved patient outcomes and higher job satisfaction among providers. I think it's important to be invested in each patient's journey to wellness and assume an active role in creating a healthier community where you live. In my opinion, the most important factor in a patient-provider relationship is communication. One of the most critical roles we play as healthcare providers is to be a patient advocate. In order to represent the best interests of a patient, it's crucial we take the time to actively listen and understand their individual wants and needs. Establishing a good rapport with my patients is absolutely necessary because they have to feel comfortable talking openly with me about what is and isn't working so we can shape their treatment plan accordingly. Healthcare should really be patient-centered, which means we can't simply follow algorithms or guidelines to decide what the best treatment course is for every patient. This means assuming a non-judgmental stance and exploring their perspective on treatment goals and taking the time to thoroughly discuss the risks and benefits of treatment options. Ultimately, I think we need to allow the patient to be in the driver's seat of their health care. Patients are more invested in their health when we encourage them to be active participants in their care, and in order to do that, we must ensure communication isn't a one-way street. My favorite part about being a healthcare provider is having the opportunity to improve a patient's quality of life. By specializing in weight loss management, I'm able to enjoy the successes of each patient's weight loss journey, and I have a chance to witness what I like to call non-scale wins. For example, when a patient comes back to me and says, "Kaitlin, I rode a bike with my son this month. That's something I haven't been able to do in 5 years." Or I can now walk on the beach with my husband without getting short of breath. These are the statements that stick with me the most and let me know I'm making a difference. Healthcare isn't just about prolonging life, but improving the quality of life. And it's extremely gratifying to know I've left an impact that reaches far beyond my office visit.